Psoriasis is a chronic skin disorder that causes dark or red scaly lesions to appear on the skin. It can develop in males or females of any race or age. An estimated 125 million people are living with psoriasis in the world.
Psoriasis can present in several ages. There are babies, there are youngsters, there are mothers, and there are, of course, the elderly. It can also be a few patches, more patches, or involve the whole body.
There are 5 types of psoriasis: plaque, guttate, inverse, pustular, and erythrodermic. The lesions can show up on any area of the skin. Psoriasis also affects the fingernails and toenails, a condition known as nail psoriasis. This condition causes pitting or formation of holes in the nails, lifting of the nail from the nail bed, and thickening and discoloration of the nail.
It does affect the nails. The nails have pitting, like the thimble pitting, the thimble that you use for knitting. The nails have pits like that. Sometimes the nail separates from the plate. The nail plate separates from the nail bed. So it becomes loose and sometimes falls off completely.
About 30 to 50% of people with psoriasis develop cirrhotic arthritis, which causes pain, stiffness, and swelling around the joints. This type of arthritis most often affects the hands, feet, wrists, ankles, lower back, and neck.
Most of the people in the West, their biggest problem in psoriasis is arthritis. But us, for reasons we are yet to establish, most of the African patients or most of the blacks don't get psoriasis arthritis. But the arthritis can also be very bad. It is close to the one we know about rheumatoid arthritis. It affects joint, it can destroy the joints, and it can debilitate.
The cause of psoriasis is not fully known, but it is believed that the condition is caused by excessive growth and reproduction of skin cells.
Once those cells form, they don't shed off. In normal individual, the cells will always form and then they shed off with time, within a month. But in a psoriasis patient, those cells just form very fast. They are stuck on one another, they don't separate, and they end up forming what we call a crust or a plaque. That's what you see, the whitish scales that you see. Those are stuck on immature cells.
In order to manage psoriasis properly, it is important to get an accurate diagnosis and also get informed on the challenges and risks associated with this disease.
Diagnosis of psoriasis is relatively easy because you can't confuse it with anything. Once you know how those plaques look like, or once those lesions look like, you will always know it's psoriasis. However, most people will have confused them for fungal infection. They will have been treated in very many places because the lesions are round, so people will always say these are ringworms.
Priscilla Bogwa has been suffering with psoriasis for 5 years now. After enduring pain and low self-esteem, she now believes she will fully recover.
I really didn't like it. And then I saw that my hair is dropping, especially when I'm bathing. When I go to the salon, they tell me my hair is dropping. Some started telling me maybe I have cancer. Some told me that maybe I've been bewitched.
The painful invisible skin lesions often lead to stress, frustration, and even depression. Psoriasis can interfere with normal daily activities, and some patients isolate themselves for fear of harassment and rejection.
I didn't accept myself the way I am, the situation that I was in. And then when it comes, your parents are also questioning you, what is happening, Your friends are also questioning you. So I don't think I embraced the condition.
Although psoriasis is recurring and progressive over time, patients can learn to manage their condition and live normal lives.
We have what we call the local treatment. Local treatment meaning that it's something that you apply on the skin. These are some ointments, some creams, and some lotions. These do help to reduce the scaling of the skin, the redness of the skin, and particularly the scratching that sometimes is very, very bothersome. Then, of course, there are pills that people take so that they reduce the scaling and also reduce inflammation.
Organizations like Psoriasis Association of Kenya work closely with patients and health workers to educate and mobilize people and to break the stigmas associated with psoriasis.
The most important thing is actually giving hope to these people, and we do that by giving them collect information about psoriasis, by empowering their families so that they know where to seek treatment, by also talking to health workers who may not be very knowledgeable with psoriasis, because in this country dermatologists or skin specialists are very, very few, and very often skin diseases are treated by other health professionals. So we empower them so that they can make the right diagnosis and give the right treatment.
Increasing awareness on psoriasis, there is hope for new understanding and advancements in the direction of finding a cure for this condition. Georgette Kareithi, Health Matters.